Hey, good morning, everybody. This is Brittany Jennings with the Seniors Blue Book, and this morning I have the privilege to be joined by Brandy Hamilton, the CEO of Suncoast Behavioral Health Center. Good morning, Brandy.
Good morning, Brittany. Thank
How
you
are
for
you this
having me.
morning?
I'm good. I'm doing well. Thank you. How about yourself?
I'm doing awesome here in outer space.
I love it.
I saw this meme the other day that every day when something happens, like a million new memes come out on Facebook and people are funny. But it was something about how the astronauts made the right decision leaving our Earth, and so I'm just up here looking for them.
I love it.
So thank you so much for joining us. I know your schedule must be pretty busy as a CEO, but can you tell us a little bit about your background personally and how you came to be over at Behavioral Health Center?
Sure. So I have actually been in behavioral health from the get-go. I started the behavioral health route actually when I was in college, and happened to get a position at a behavioral health facility in Kentucky where I'm from. And I worked as a mental health tech on the units with the patients. And I started out with the children and adolescents and really worked across the population. And I just fell in love with behavioral health and just stayed in that realm and worked my way up through different hospital systems into multiple departments, and made my way down to Florida about 13 years ago, and was originally in marketing and business development for several years. And then about 5.5 years ago, I transitioned and became CEO, and that brought me to the Bradenton, Manatee County area. And so I've been here since then.
That's awesome. You've got a great background. And, I think once you find your true calling, like you said from the get-go, same thing, like for me, for assisted living and just the senior living industry in general, like you just kind of find that fit and it feels really good. And that's where you're going to be.
Yep.
Well, that's awesome. Can you tell us, so Suncoast Behavioral Health, we've talked to Misty several times on different topics. And so thanks for allowing her to be a part of Seniors Blue Book in our talks. Today, I kind of want to find out more about you and who you are as a health center there. So could you tell us what type of facility Suncoast is?
Sure. So Suncoast Behavioral Health Center is an inpatient mental health facility. We've been in the Manatee County area for about 5.5 years. Actually, September will make 6 years that we have been here. And so we're treating, children, adolescents, adults, and what we call mature adult population. And we are, like I said, inpatient mental health, and we also have outpatient programs for our adult population. So we are a Baker Act receiving facility here in Manatee County, and my admissions department runs as a 24-hour operation. So it basically runs as an emergency room for mental health patients. So anybody can walk in the door, family can bring somebody in, a doctor can send somebody over, an ALF or a nursing home can call around the clock, and my team is there to take those phone calls and do those assessments and help the community with whatever mental health needs that they have.
That's awesome. And so you mentioned, the different, I guess we'll say generational, populations that you serve. I know in Sarasota, in Manatee County, the areas that I'm in, that's what we live and breathe. And so to kind of break it down, how is it like a certain number of beds per population, or how does that work?
It is. So I am licensed for 20 child and adolescent beds. And the way I'm set up is I have a 20-bed child adolescent unit. And so they're housed on the same unit, but they are programmed from a clinical standpoint separately. So we program our children from 5 to 11 to 12, depending on the child. Some 12-year-olds really are better suited with that younger adolescent population. And then there's some 12-year-olds that really are going to be more clinically suited for the child population. So we separate them based on that from a clinical standpoint. And then I have 40 adult beds. And the way that we decided to separate our adult population, because I have two 20-bed adult units, about almost a little over a year now, we decided to separate our adult population based on age. And so I have a 20-bed general adult unit. And then I have a 20-bed, like I said, what we call a mature adult unit. So it allowed us to separate our patients that way, which, you know, has just been significant, just based on, you know, the issues and the things that older population are dealing with versus, you know, a 20 or a 30-year-old. They're just in two different times of their lives and have gone through different things. And so we decided to separate based on that, and it's made a significant difference for the patients and for the staff.
I bet. I can imagine the interest levels of, or, you know, even where they're at in their journey, you know, who can they relate to and things like that. Programming makes a huge difference.
Yeah.
So specifically, you mentioned that you have some different programs there. What are some of the specialty programs that you offer?
Well, like I said, the mature adult unit is definitely a specialty that we opened up about a year or so ago. And we, you know, my medical director is a geriatric boarded psychiatrist. And so he is seeing that population. A lot of my staff on that unit are CNAs, have worked in the ALF and nursing home, geriatric programs for most of their career. You know, we were talking about earlier, Gail, my new therapist on that unit, came from, you know, the nursing home ALF world and was in that for years. And so she's now going to be our therapist with that population. And so that's one of our specialties. And then child and adolescent also as well. You know, there's not a lot of facilities that treat children and adolescents from a mental health standpoint. And so I would say that that's also definitely a specialty. And then we also have a couple outpatient programs for the adult population. So we have a partial hospitalization program, which is a pretty intensive program, and it can be used a couple different ways. So some of our patients will step down into that program once they complete their inpatient hospitalization. It's like a stepping stone, a next step before they go back to just seeing a therapist or a psychiatrist once a month. But some of our patients also will use that program to keep them out of the hospital. And so that program meets Monday through Friday, 9 to 2:30. So it's pretty intense, where they see a psychiatrist once a week. And then it's just different types of group therapy throughout the day. So it's a pretty intensive program. And then we have a step down from that, which is considered an intensive outpatient program, where, again, once they've completed the partial program, they may step into that next step program, where they just come 3 days a week for 3 hours a day. So it's a little less intensive, but still a little bit more than just seeing a therapist or psychiatrist once a month or, you know, once every couple months. So we have those specialty programs right now for adults. And then, you know, in the future, we're looking at potentially adding an outpatient program for children and adolescents as well. So.
That's awesome. I think that the reason why we do this, why we educate and go on here, because especially right now, you know, that this is how people are getting information from social media and YouTube or whatever it might be, is that people need to know their resources. And I know me, I'm guilty of, you know, asking that question, why are there not more mental health services out there for kids, for adults, for mature adults? And so you guys, when I came on board with Blue Book, you were like a new resource for me. And I just want to like shout it from the rooftops, you know, like all the services you provide, and people really need to know what you do. Can I ask you, what has been the response and actions taken by Suncoast during COVID-19?
Well, you know, a lot of things changed for us. And we had to look at that and see what we needed to do to keep our patients and keep our staff and to keep the community safe. And so we've done lots of things. You know, it started with looking at one point of entry for my team and for any vendor or visitor coming in. We are screening everybody coming through the door. So all of my employees have to be screened prior to their shift. I have one staff that is assigned to be a screener every day. And so we're asking very specific questions that came out from the CDC, taking temperatures and documenting and keeping logs of all of that. We also do the same for vendors. So even from, you know, if my pharmacy vendor is dropping off medications, they have to be screened before they can come in the door. My food service truck, if delivering food, has to be screened before they can come in the door. Unfortunately, we had to stop visitation for our patients a couple months ago. We stopped that back in March. And so, they've been able to utilize Zoom to do visitation if they need to. And then we've increased the phone call time so that they still have that ability to have contact with their loved ones while they're here. But we have, when this first started, we ended up capping some of our units so that we made sure that we had enough space for our patients to socially distance. We cut down our group sizes, again, to make sure that we had enough space and that they could be social distanced. We've done a lot of training with the staff. We've done specific COVID training with the staff. We added hand hygiene time in our patient schedules several times a day to help encourage our patients while they're here to understand the importance of hand hygiene during this time. Internally, we moved most of our meetings internally have all gone to Zoom. So we sit in our offices and do our meetings from our office. So we're not all congregating in one room where it's a little more difficult to social distance in. So we've moved that. The doctors have moved treatment team the same way. And we actually moved my doctors to seeing all the patients via telehealth during this time as well, so that the patients are still being seen, just they're not in that small office space where they would have been before to be able to see those visits. So the doctors are doing that. All of my staff in patient and non-patient care areas were provided masks and are required to wear them, throughout the hospital and patient care areas. So we've done lots of things during the COVID and are continuing to do so, and getting ready to start to meet to see, what that's going to look like. What's our new norm going to be? What's it going to look like,
Right.
Moving forward? And what do we need to continue to keep? What can we look at? At some point we'll add back visitation, probably in smaller doses than we did originally, but so that people still have that ability to come in, but now with some additional probably requirements where they'll have to wear a mask and they'll have to use hand sanitizer before they can come in and out. And so, things are going to look at a little bit different. And so we're starting to look at that and how we can somewhat move to, I guess, back to, what that new norm is going to look like. So.
Exactly. And I'm sure like every single week it's a new norm, it's something changing, but you guys are doing a fantastic job. It sounds like staying on top of everything before everything. And you mentioned changes, of course, like technology and telehealth, and I just want to ask, are there any other changes that have been made in the services themselves, like maybe the way that the therapist interacts, besides wearing a mask and such?
Yeah, actually we did. So the outpatient programs I was talking about, our PHP and IOP programs actually moved to full telehealth. So those patients have not been coming into the hospital for those programs, which they used to do. I think we stopped, actually it was the end of March as well. We moved all of that to telehealth. So the patients now are receiving those services from the comfort of their own home. So as long as they have a smartphone or a tablet or a computer, then they just hop on and are doing their therapy sessions via telehealth, which is pretty cool, actually.
It is. It's amazing.
Yeah, and it's gone over very well. They've actually liked it. We actually had, I would say, some more participation from people that maybe had issues with transportation before, that then could, still get the services that they needed from their home because they had the technology to be able to do so. Whereas if they had to come here, maybe they didn't have the transportation to get here. So, it's actually been really beneficial to an additional set of patients that maybe didn't have the ability for those services before. So.
Yeah, that's an excellent point, because I know working, with seniors, I know transportation can be a huge roadblock, not to be pun on words there, but it can be a challenge. And so this, I really do feel with what you guys are doing with telehealth and a lot of companies, even like rehab, other types of rehab, like physical therapy and such. Yep. I've seen so many innovative ways for people to continue their treatment and get the care they need. And it's so important right now, more than ever, possibly.
Yeah, absolutely. And we're also starting to move to my intake department to be able to do assessments via telehealth.
Oh, very cool.
So yeah, with ALFs and nursing homes, and we work with one of the local hospitals to see their patients if they're admitted on a floor via telehealth. And so we have that capability, and so we're starting to expand that out, for people to be able to use that service too. If they don't feel comfortable coming in for an assessment, but know they need mental health services, then some people may be more apt to use that than actually coming into a facility, still during this time where people are still trying to figure out what they're comfortable with and what they're not at this point. So
definitely. And I think one question too that we definitely need to touch on is with insurances. So if somebody is needing your services, probably one of the first questions they ask is, is this a private pay type of service, or do you work with insurance companies?
Yeah, so most all insurances cover our program. So we take Medicare, all of the Medicare plans, the private insurances, your Blue Crosses and Cignas and Aetnas and United Healthcares, and even the Medicaid. Medicaid covers the inpatient and some of our outpatient programs, which before, Medicaid didn't cover.
Right.
So that population didn't have that ability to be able to receive some of those outpatient programs, but now they do. And so we're contracted with all of those and take all of those services, and it covers the treatment that they need to get to receive.
That's amazing.
Yeah.
Well, thank you so much for being here today. I think we covered some great information. And again, this is Brandy Hamilton. She's the CEO of Suncoast Behavioral Health Center. And could you share just your location exactly in Bradenton?
Sure. We are in West Bradenton off of Cortez. Our address is actually 4480 51st Street West, and that's in Bradenton. We're right behind Walmart off of Cortez on 51st. So great location, easy to get to. And, Brittany, I really appreciate you taking the time and inviting me on this morning. I think what you do is fantastic. Like I said, my team speaks very highly of you and Senior Blue Book and all that you are doing for the community, and to ensure that everybody has the information that they need and that we can share with each other and be that resource that this community needs. So I really appreciate it.
Oh, I'm speechless for a second. That never happens. No, I just haven't had enough coffee yet in my day.
Yes.
No, thank you. And what's the best, phone number if somebody is interested in information or they do need to reach out for intake?
Yeah, sure. And like I said, it's 24/7. So my intake department is available 24 hours a day, 7 days a week. And you can reach us at 941-251-5000. And just ask to speak to my intake department. And after hours, there's a prompt on there for the intake department. And we will definitely take care of whatever needs or questions or resources that you need. If we don't provide them, we'll help connect you to somebody that does.
Perfect. Awesome. Well, again, thank you so much. And for everybody that's listening, I'll make sure to put all the information for Suncoast and Brandy's team to reach out to as a resource. And I hope you have a wonderful rest of your day.
Thank you. You as well.
Thank you.